Welcome to The Explainer. In medicine, sometimes the simplest looking things turn out to be the most revolutionary. And today, we're talking about a perfect example of that. It might look like just another oxygen tube, but this device, high-flow nasal cannula, has absolutely changed the game in emergency medicine.
All right, so here's what we've got on tap. We're going to start with the problem, then introduce the solution. We'll break down the science behind it, look at the proof, see how it's actually used in the ER, and then wrap it all up with a big takeaway.
Okay, first up, before we can really get why this thing is so special, we've got to understand the problem it was built to solve. So picture this. Someone is hypoxic, they're restless, they're working hard just to take a breath. Yeah, it's a scene that plays out in emergency rooms all the time. It's that terrifying moment when someone just can't get enough air and you know the clock is ticking.
And believe me, this isn't just a problem in one or two places. I mean, look at this data. Whether you're in the United States or the United Arab Emirates, shortness of breath is one of the top 3 reasons people end up in the emergency department. It's a global issue for sure.
So for a long time, doctors were kind of stuck between a rock and a hard place. On one hand, you had your standard oxygen therapy. Simple, easy to use, but often just not enough. On the other hand, you had non-invasive ventilation. Think of those big, tight-fitting masks. Super effective, yeah, but incredibly uncomfortable. A lot of patients just couldn't tolerate them. So you see, there was this huge gap right in the middle of respiratory support. So what do? How do you bridge that gap? Well, this is exactly where high-flow nasal cannula, or HFNC, comes in. Now, don't let the name fool you. This isn't just a more powerful version of a regular nasal cannula. It's a whole system. First, you've got an air-oxygen blender, so you can dial in the exact amount of oxygen you want. Then, and this is key, an active humidifier warms that gas up to a perfect 37 degrees Celsius. A heated tube keeps it that way all the way to the patient, where it's delivered through a really comfortable nasal cannula. It's a pretty slick setup. Okay, so how does this whole setup work its magic? How does it have such a huge therapeutic effect? Well, it really comes down to 4 pretty amazing physiological mechanisms. All right, number 1, and this might be the biggest one, dead space washout. The high flow from the HFNC, we're talking up to 60 liters a minute, basically acts like a power washer for your upper airway. It just flushes all that old, used air out, meaning your next breath is pure, fresh, oxygen-rich gas. It makes every single breath way more efficient. Second, all that high flow creates a bit of gentle back pressure. In the medical world, we call this PEEP. What it does is it helps keep those tiny little air sacs in the lungs from collapsing when you exhale. It's like gently inflating a balloon just enough so it doesn't completely deflate. And that little bit of pressure makes a huge difference for getting oxygen into the blood. Number 3 is all about consistency. See, when someone's struggling to breathe, they're gasping for air, right? A standard oxygen tube just can't provide that much flow. So what happens? They end up sucking in a bunch of room air, which dilutes the oxygen you're trying to give them. HFNC solves this completely. By delivering that super high flow, it meets their entire demand. So if you set the oxygen to 50%, you know they are getting exactly 50%.
And finally, number 4, perfect humidification. This is so much more important than it sounds. Blasting cold, dry gas into someone's nose is really uncomfortable, and it dries out the airways. HFNC delivers air that's already warm to body temperature and is 100% humidified. This is way more comfortable, and it's a huge reason why patients can stay on this therapy for so long.
So yeah, the science sounds great on paper, but does it actually work in the real world? Well, let's look at the evidence, because this is where things get really, really interesting. Okay, so when researchers pitted HFNC against conventional oxygen therapy for patients in acute respiratory failure, the results were just undeniable. The HFNC group had better oxygen levels, for sure. But here's the kicker. They were significantly less likely to end up on a ventilator. They avoided intubation. That's a massive win. And we all saw this play out on a global scale during the COVID-19 pandemic, didn't we? Hospitals were just overwhelmed with patients struggling to breathe. HFNC became an absolute cornerstone of treatment. It was pivotal. It allowed medical teams to manage these incredibly sick patients and, in so many cases, keep them off of a ventilator. And if you think that's impressive, look at what it does for kids. For tiny infants with a nasty respiratory illness called bronchiolitis, HFNC has a staggering 93% success rate at keeping them off a ventilator. 93%. I mean, that's just incredible.
All right, so we've established this is a seriously powerful tool. That means you need to know how to use it right, especially in the chaos of an emergency department. So what's the playbook?
So who's the perfect candidate for HFNC? Well, you're looking for patients with low oxygen who are still awake and alert enough to protect their own airway. This is your go-to for things like pneumonia, early ARDS, and it's great for heart failure patients who just can't deal with a tight mask. It's even used to provide comfort for patients in palliative care. The basic strategy is pretty simple. Hit them hard, then back off. For an adult, you'll start with a really high flow rate, like 50 or 60 liters per minute, to give them that maximum support right away. You'll also crank up the oxygen, sometimes all the way to 100%, to get their O2 levels up fast. Then, as they start to improve, you can slowly and carefully start dialing everything back.
Okay, but how do you know for sure if it's working? You can't just guess. That's where this really clever tool called the ROX index comes in. It's just a simple calculation you can do right at the bedside. It takes their oxygen level, the amount of oxygen you're giving them, and their breathing rate, and mashes it all together into one single number.
And that one number tells you so much. If the score is above about 4.88, you're in good shape. It means the therapy is probably going to be successful. But if that score drops below 3.85, that's a huge red flag. It's a signal to the team that this isn't working and they need to get ready to intubate.
Now, it's super important to remember that HFNC is not the answer for everyone. It's not a magic bullet. There are definitely times you should absolutely not use it. We're talking about patients who can't protect their own airway, someone unconscious, for example, or patients who are in shock or have major facial injuries. In those situations, you go straight to a breathing tube. Delaying is just too dangerous. So, let's bring it all home. What's the final takeaway here? The big idea is that high-flow nasal cannula is so much more than just a souped-up oxygen line. It really represents a fundamental change in how we approach respiratory distress. It's the tool that perfectly filled that dangerous gap between simple oxygen and needing a ventilator. It has saved so many people from the risks of intubation. And as the technology keeps getting smaller and smarter, you have to wonder about its potential outside the hospital walls. So I'll leave you with this question. What's the future look like when this kind of powerful respiratory support isn't just for the ER, but something that could be used in our own homes?